PPT is visible.
Yes, ma'am.
The chemical include phosphoric acid and arylic monomer and erosion, bacterial toxins associated with the caries, and direct invasion of the pulp from caries or trauma, and anthrosis. So, according to classification of pulpal diseases, so right now we discussed about the etiology of pulpal disease. So, next is classification of pulpal diseases. So, again, according to Grossman, you have few classifications. The first classification is based on the clinical features that are exhibit in a tooth. So, first is pulpitis, that is also called as pulpititis, which is nothing but the inflammation of the pulp. So, under pulpitis, you have either reversible pulpitis or irreversible pulpitis. Under reversible pulpitis, you have again symptomatic, that is acute pulpitis, which stays only for a shorter period of time, and it is uh, manifested by the symptoms. The second one is asymptomatic pulpitis, which is chronic, like it stays in the body for a longer period of time, but it doesn't exhibit any symptoms. So next is irreversible pulpitis, that is irreversible damage to the pulp. Again, you have acute and chronic. In acute, that is a shorter duration, again you have abnormally responsive to cold. So the pain will comes only if the tooth is get responded to cold, and the pain will comes only if the tooth got exposed to heat. So in the under acute, you have again abnormally responsive to cold and abnormally responsive to heat. Second one, you have chronic. Under chronic, again you have asymptomatic one, like you don't have any symptoms, but the pulpal exposure is clearly seen. Next is hypoplastic pulpitis, that is a chronic inflammation of the pulp, and the third one is internal resorption. So based on the clinical features, pulpitis, again pulpitis reversible and irreversible. In reversible, again you have acute and chronic. In irreversible, you have acute and chronic. In acute, you have abnormally responsive to cold and heat. In chronic, you have asymptomatic hypoplastic pulpitis and internal resorption. The second one is pulpal degeneration. Like previously, you on clinical features, you have pulpitis, that is inflammation. Next is pulp degeneration. So the degeneration can be either calcific, like calcium deposits are seen in the pulp, or it can be due to other reasons also. The third one is necrosis. Here you won't see any inflammation. The pulpal necrosis will be clearly seen. So next, the factors affecting the response of pulp. So if the pulp got exposed to any stimuli, the pulp will respond in a certain manner. So what are all the factors that are affecting the how the pulp will respond? It is decided by certain factors. The first one is if an irritant is thrown, its effect on the pulp. So what is the severity of the irritant? Is the irritant is too much or it is very mild? So and duration, how much time the irritant is accustomed to pulp. So how much time the irritant is placed on the pulp, shorter duration or longer duration. So the severity and duration of the irritant will affect the response of the pulp. Next, the nature. The irritant is either bacterial or physical or chemical or thermal. What is the nature of the irritant? And before the act of irritant on the pulp, what is the health condition of the pulp? Is the pulp is healthy or it is having any predisposing, like in patients you will see that if you have any predisposing hypertension and diabetes, similarly the pulp is good or previously it has any exposure or any irritant exposure. That also will determine the response of pulp. Next, what is the blood flow in the apical region and what is the local anatomy of the pulp chamber and how the host, that is our body, is responding to the response. So next, the pathways of bacterial invasion in the pulp. So this last class also in the rationale of endodontics, we have seen what are all the apical roots and what are all the central roots. So first, the pathways of the bacterial invasion. So anytime the most common cause of pulpal injury is irreparable damage to the pulp. So if you come from the above tooth structure, you have openings in the dental hard tissue wall. They from the openings, the caries, like the microorganisms which cause the caries, staphylococcus and streptococcus, they may enter into the pulp. And the clinical procedures, what you do during your class 1 and